There's been mixed opinions when it comes to vaccine passports and certificates. The Ontario government isn't in favor of it, but some health experts and businesses say, well, they may be necessary for a safe return to pre-pandemic normal. Joining me now for this discussion, infectious diseases physician and member of Ontario's Vaccine Task Force, Dr. Isaac Bogoch. We welcome you back to BT. Good morning.
Hey, good morning.
Oh, it's been some time, and since we haven't talked since we both got a haircut, so it's been a long time, right? Feeling fresh.
Absolutely. Thank God for that.
I don't know if you saw Dina's whole compilation video, but it was a thing, right?
Great music.
Yeah, let's talk a little bit about vaccine passports, because that is the hot topic right now. Vaccine passports, vaccine certificates, whatever you want to call it. And it's creating such a division within the way people are feeling, the vaccinated versus the unvaccinated. What's your take on if they should be happening and where they should be happening?
Yeah, certainly. I completely appreciate that this is a hot button issue. And it's interesting, though, when you look at polls of Canadians, in fact, the vast majority of people are in favor of this. And if you ask the business community and you speak with business leaders, they're also in favor of this. But of course, there is a tug of war between people who are ensuring their individual rights and freedoms are adhered to versus public health and public safety. I mean, if you take a step back and look at what is being proposed in a place like Quebec, they're basically saying, listen, you need it. First of all, if things are getting bad, if for example, the healthcare system is being threatened, they will request proof of vaccination or immunity before gaining entrance to non-essential settings like restaurants or bars or movie theaters, places where they're closed indoor settings where we know COVID-19 can be transmitted. Obviously, it's controversial, and some people are in favor of this, other people are not. I think we should at least be open-minded to the idea because this pandemic is not over yet. We have significant community-level protection with the high rates of vaccination, but there's still millions and millions of people who are unvaccinated who can get this infection and transmit this infection. So at least we should be open-minded and have these conversations now.
Okay. We had Dr. Kieran Moore on the show last week, and we talked about that goal, the very big goal of a 90% of double vaccination. And that's a big goal. Do you think that's a realistic goal to get Ontario to that place? Because when we look at the unvaccinated population, who are we talking about? Because it's not just people who don't want to get the vaccine. There are some other factors at play as well.
Absolutely. I think when we look at the unvaccinated population, it's some people who have chosen not to be vaccinated. There's some people who still have barriers and limitations to vaccinations. And again, the whole push is to lower as many barriers as possible. There's people who are ineligible, right? There's a lot of people who are under the age of 12. I think it's fair to say that there's a lot of people who are still, for lack of a better word, hesitant, who have some questions and concerns. And we need to address that and lower any possible barriers and take those questions seriously, take those concerns seriously, spend the time to answer those questions. So it's a pretty heterogeneous group of people. Now, can we get to 90%? I honestly don't know. I think it's a very laudable goal. When we look at the polling, it suggests that we'll probably make it to around, 83 to 87%. But I think if we do a very significant push, lower every possible barrier, combat misinformation, especially online, address questions, address hesitancy in an empathetic and data-driven manner, we'll clearly get to the higher end of the spectrum.
Okay, we'll be watching over the next few weeks. Very quickly for you, we got about 30 seconds. I know you got to run. We are waiting on that back-to-school reopening plan. We're waiting on it from the Ministry of Education. What would you like to see in it?
Well, I mean, there were some recommendations by the Ontario Science Table with broad stakeholder engagement, including educators, mental health experts, physicians, scientists, public health leaders. I mean, and I thought that was very comprehensive and very reasonable. They talk about ventilation, masking in some settings, cohorting in some settings, really taking a regional approach based on the risk in the particular part of Ontario that you're in, because this is such a massive place. You don't really need a one-size-fits-all solution. They talked about things that should be permanent, like better ventilation in the classrooms, versus things that are temporary based on the current risk. Comprehensive document, and I really hope that they look at that closely because I think everything's in there that they need.
All right, Dr. Bogoch, as always, appreciate your time. Thank you for taking the time with us today.
Have a great day.
Take care. 7:12 is your time right now. Dina said the hair looks good.